Hi, everyone. I'm Katie Couric here with Dr. Jon LaPook, who is our resident physician and great guy. And Jon has actually been on a campaign for several years now to make sure that defibrillators are located in a lot of public places, because this is truly a life-saving device. And we're going to demonstrate for everybody watching how to use one, because I think if you don't know, it's pretty intimidating. But when you do know, it's really, really simple, right? Why is this so important, Jon?
Well, because what kills you when you have a heart attack is not the heart attack itself, but the abnormal rhythm of the heart. So that you suddenly, instead of beating regularly, you have a bag of worms that the heart is beating like, and blood doesn't get up to the brain, and you pass out and die. About a million people, more than a million people, have a heart attack a year, but only, I mean, it's a lot of people, 300,000 actually have sudden cardiac death. And of those, about half of them have never had any previous history of any heart disease. So it's a big surprise.
And another amazing statistic is if you use this within a few minutes of the individual collapsing, their chances of survival increase from like 0 to 60%, something like that?
Nationally, if you go down and nobody's around, about a 4 to 6% survival rate. If you have CPR, it can go up to about 15%. And with these devices, it can go up to 30, 40%, even higher. Because for every minute of delay after the person goes down where they don't get shocked, your survival goes down 7 to 10%. So by 10 minutes, it's really tough to think about long-term survival.
And one of the reasons we want to remind people of this is because of our dear friend, my dear friend, and I know you probably had met Tim on occasion. Tim Russert recently died of a heart attack. Would this have helped him? I know it's hard to say in specific
I always
situations.
hate to be looking backwards and think what coulda, woulda, coulda, shoulda.
Because he had a piece of plaque which really created an embolism, right?
Yeah, and that's the misconception also. It was just a tiny, he had a normal stress test, right? So there wasn't a big blockage. It was a tiny piece of fat that was in one of the arteries. That suddenly ruptured. That caused a blood clot. That caused a complete block of that artery. And that part of the heart that was supplied by that artery didn't get enough blood flow. You had death of the muscle cells there, and it wasn't that heart attack. That's called a heart attack. It wasn't that killed him. What killed him was that then that irritation caused an irregular heartbeat, ventricular tachycardia, ventricular fibrillation, and it was the irregular heart rhythm that caused him to go down and have sudden death.
Well, I don't want to put you in the uncomfortable position of sort of analyzing what happened to Tim, but the bottom line is this can save lives. So let's show people really quickly. Are these in most public places, by the way, Jon?
You and I did a demonstration of this about 11 years ago, and that was the first time I think it was shown on national television. At that point, it was just in a few places, and over the last 11 years, you're seeing them in casinos, you're seeing them
airports,
in
airports, I see them.
More and more, and they're becoming more and more popular. They're still not out there in enough places, and not enough people know about them. For 100% sure, any health club should have one.
And by the way, if you have an office and there isn't one there, you should get all the employees together and absolutely insist there is. Okay, all right. So
let's say the person's gone down. Now we're not going over CPR today, okay?
Right.
But the first thing that you do, want to just make sure everybody knows, when you go down, the first thing to do is call 911 or have somebody call 911.
Then you get this defibrillator.
The person's down, and really all you have to remember is hit the on-off button.
And it's so easy. So you have this green button here.
And before you hit it, Betsy Nabel, who's the head of the National Heart, Lung, and Blood Institute today, really wanted me to emphasize that if people don't know anything about AEDs, they're not trained, but they see somebody go down and they see an AED on the wall, give it a shot. There are Good Samaritan laws in 50 states. You're protected. Give it a try. And
it is really easy. Okay, so we turn it on, and it basically tells you what to do.
Tells you what to do.
Remove clothes from patient's chest.
I've already done that. I hope that's okay. All right, go ahead.
Okay, so
when patient's chest is bare, open gray plastic case and look carefully at the pictures on the white adhesive pad.
Here's
okay,
the picture.
One
I'm going to
white
do this so
pad
people
from
can see
the
it
gray
at home.
case.
Okay, so
Place pad exactly as shown.
So I'm taking this pad.
Press firmly to bare skin.
So I do this right like this, Jon, right?
Sure.
Right above her right.
When the first
breast.
pad is in place,
Right upper chest.
peel the second pad. Place pad exactly
again.
as shown.
And
Is
it's
this
right on
exactly?
the, yeah, and then it's exactly, you did it exactly
Press
right. It's
firmly.
right like it's on the pad.
Stay
Press firmly.
clear of patient.
Okay, so
Analyzing heart
can you
rhythm.
get hurt if you don't stay clear of patient, by the way?
Well, no, not
Stay
until you hit the
clear
shock
of
button.
patient.
So it's analyzing.
Okay,
It's got a
okay.
computer in
Analyzing
it.
heart rhythm.
It's analyzing all the potentially fatal rhythms. It's saying, does this person
Shock
have a
advised.
potentially fatal
Shock
rhythm?
advised.
Clear of patient. Press
Go ahead.
the flashing orange button now. Shock delivered.
I feel like I'm on ER.
No,
Emergency
shock
medical
advised. Now let's
services
switch
have been
Okay,
places.
wait, wait, let's
It
listen.
is safe to touch the patient.
Hi,
Begin
how you doing?
CPR.
Begin
For help
CPR.
with CPR, press the flashing blue button.
Okay, let's press this.
Yeah,
Why
press
not?
it. What's
Place
nice
the
is
heel of one hand in the center of the chest between the nipples.
People
Place
can
your
get
other
excited.
hand
Wait a second.
on top of the first. Push the chest down firmly 2 inches. Keep time with the beat.
They even give you the beat. So
Right. So people get excited. They go too quickly, but they
Yeah.
say, no, go slower. Go like
It's
this.
almost like one press per second, right?
Well, you just have to follow. You don't even have to think
But
about
I'm
that.
just
It's
saying,
30
let's
and
say
2.
if somebody needs to do CPR, it's about.
Yeah, it's 30 and 2. 30 compressions for 2
Pinch
breaths.
nose, tilt head, and give 2 full breaths. Breathe. Breathe. Continue with compressions.
Now, what's happening is if the person went down and they just fainted, they were perfectly fine, then it would have said no shock advised.
Okay.
So you don't have to worry about hurting somebody who's down and is, perfectly fine. They just fainted.
So basically, given the shock, when will we be able to determine if in fact it jump-started the
Pinch
heart?
nose, tilt head, and give 2 full breaths. Breathe.
You can take her home later if you want, John.
Breathe. Continue with compressions.
So
Okay.
what it's doing is it's giving a couple of minutes of CPR following the shock, and then the protocol says, get off of the patient at that point, and they'll analyze again. The computer will analyze again, see how did you do with the shock.
Okay.
So that'll happen in maybe another 30 seconds or so.
Okay.
Like that.
All right. Well,
we can talk.
Yeah, we can
Pinch
talk.
nose, tilt head, and give 2 full breaths. Breathe.
I think the important thing to realize is,
Continue with
it
compressions.
could not be more, understandable. You have a voice telling you every step of the way what to do. And I think most people would feel extremely comfortable taking this defibrillator and using it.
Absolutely. And you hate to have, and I've had the very sad conversation with people,
Pinch nose,
what woulda,
tilt
coulda,
head,
shoulda, if
and
they
give
had
2
possibly
full
had an
breaths.
AED.
Yeah.
Breathe. Breathe. Continue with compressions.
And I should add, people are afraid of hurting somebody. You can't be more dead than dead. And, that sounds cold, but...
Can I quote you on that?
Yeah, I mean, it's medical analysis, but it's true. I mean, people have very little chance of survival if they go down and they're not helped. If you are defibrillated within 4 minutes, you've got a nice chance of coming back.
Stop CPR.
Now it's going to...
Stay clear of patient.
Okay.
Figure out if it works.
Analyzing heart rhythm. Stay clear of patient.
Okay.
No shock advised.
Okay. So
Wait a
that
second.
means
It's
that
safe to touch the patient.
So-
no shock
if
advised
needed,
meaning...
begin CPR. For help with CPR, press the flashing blue
So
button.
what that just told us is...
But did it say she's okay?
It said no shock advised, and that means that in this case, probably the rhythm, there's nothing to shock, so the rhythm...
So can
in
we
this-
assume that she's breathing and she's going to be
Congratulations.
okay?
Dr. Couric?
Thank you,
saved a
Dr.
life.
LaPook.
And it really is that easy, and in this case, it's just a demo, but in this case, the way it's programmed is you give one shock, it was ventricular tachycardia, ventricular fibrillation, and it worked. You shock the person back to a normal sinus rhythm. Person will presumably get a pulse and can wake up. And I've seen that happen. Person get a shock, they're out, they're dead. They get a shock, they wake up, and they're talking to you.
And
It's
there
pretty
might be,
amazing.
the machine might call for you to do another shock if in fact it wasn't enough.
Right. It'll keep talking you through it. And that's the thing. People come in there, people say in an emergency, first take your own pulse.
Yeah.
Because you get like that. You get adrenaline. And that's
Of
why it's
course.
counting down the beats, because people tend to go way, way too fast. They're just flying with the adrenaline. So it calms you down. It talks to you, reminds you, call 911.
Right.
I mean, it couldn't be easier.
All right. Well, John,
Potentially
thank you for the
life-saving.
demonstration. Hopefully folks watching this
Yeah.
won't be intimidated by when it comes to using this. And as you said, it can really save a life.
And there are courses out there. Everybody should take a CPR course. Everybody, we didn't go over CPR. Everybody should take a CPR course, an AED course. That's these automated external defibrillator. And you can go online to our partner in health.
Right, webmd.com, right?
And right, and we'll have other websites like the American Heart Association.
But I think really we want to point out that, this really, you could have like a second grade education and do this. I mean, anybody could actually get the defibrillator, listen to the instructions, and make it work.
Right. This is what I meant when I coined the term. It's a no-brainer.
Yeah. Did you coin that term?
What, you didn't know that? I should have copyrighted that.
Anyway, okay. Jon LaPook, thank you very much. And that does it for us. So I don't know where you can get one of these babies to practice, but you enjoy her this weekend. See ya.